Welcome to the Deep Dive. We're the show that takes a stack of sources, pulls out the key info, and helps you get up to speed fast.
That's right.
Today, we are diving deep into a real giant. I mean, imagine a company so big, so tangled up in daily life. Its care services alone touch almost 100 million people.
Yeah.
And it manages over $400 billion in annual revenue. It's quite a landscape we're exploring.
It really is. Today's focus is all UnitedHealth Group, or UHG. Definitely one of the biggest players in healthcare and well-being generally.
And our main source today?
It's their own document, the 2024 Form 10K annual report. It's quite the treasure trove if you want to understand their business.
Okay, so our mission here is to unpack this huge organization. We want to look at its two big engines, the maybe surprising range of services they offer, their financial health, and of course the big challenges and opportunities they're facing.
Mm-hmm.
By the end, you should have a much clearer picture of this healthcare giant and just how much impact it has. So let's jump in.
Right. So to really get that scale, think about this. UHG reported over $400 billion in total revenues for 2024, just a massive number.
Wow.
And they employ nearly 400,000 people.
400,000.
Yeah, and get this, over 140,000 of them are actual clinical professionals. Doctors, nurses, therapists, you name it.
Okay.
Their stated mission is to help people live healthier lives and help make the health system work better for everyone.
That's a huge goal.
Yeah.
How does a company that enormous even structure itself to tackle something like that?
Well, they basically operate through two distinct but very complementary core businesses. Think of them like two big engines driving everything.
Okay.
First, you've got UnitedHealthcare. That's the health benefits side. It's what most people probably think of as, health insurance.
Right.
Their goal there is to simplify the whole healthcare experience, make it more affordable, basically providing a full range of health benefits.
So UnitedHealthcare is the part facing consumers, managing the health plans. What's the other engine?
That's Optum. Optum is their information and technology-enabled health services business.
Okay.
So while UnitedHealthcare is focused on the benefits, Optum is really aimed at improving the kind of underlying healthcare system itself, making it more efficient, more value-driven, more connected.
Interesting. Two sides of the coin.
Exactly. And then within those two big businesses, UHG breaks it down further into four key reportable segments. You've got Optum Health, Optum Insight, OptumRx.
Okay, three under Optum.
Right. And then the fourth is the combined UnitedHealthcare segment. And even that is made up of three big parts: employer and individual, Medicare and retirement, and community and state.
Okay, that gives us a good map. Now, let's zoom in a bit. Let's really see the scale of these different parts because they all seem to have a massive reach. Starting with UnitedHealthcare, what are its different arms actually doing?
Absolutely. So first, the UnitedHealthcare employer and individual segment. This is where they provide health plans for employers, from small businesses right up to huge national companies. Domestically in the U.S., this segment serves nearly 30 million people. 29.7 million, to be exact, as of the end of 2024.
Almost 30 million just in the employer and individual market.
Yeah, and the report notes they saw strong growth there in their commercial offerings in the U.S. Interestingly, though, they did note a big decrease in people served globally because they sold off their Brazil operations.
Okay, so focusing more domestically while pulling back a bit internationally. Makes sense. And then there's Medicare and retirement. I mean, it has to be just enormous, right, given the demographics.
Oh, absolutely enormous. And it's a huge revenue driver for them. This part is tailored for seniors, obviously, and others eligible for Medicare.
Right.
End of 2024, figures show they served almost 8 million people through Medicare Advantage plans.
Wow.
And another 10 million plus in Medicare Part D prescription drug programs. Some of those are standalone, some are part of the Advantage plans.
So huge numbers in Medicare.
Huge. And here's something I found really fascinating.
Yeah.
Their house calls program.
House calls. What's
Right.
that?
They actually performed almost 2.9 million clinical preventive home care visits in 2024.
They sent clinicians into people's homes nearly 3 million times.
Yeah. Shows a real push towards proactive care, meeting people where they are, preventative stuff.
That's pretty incredible. And it really highlights how tied they are to government programs, doesn't it?
Oh, massively. You hit it right there. Premium revenues just from CMS, that's the Centers for Medicare and Medicaid Services, accounted for 40%. 0% of UHG's total consolidated revenues in 2024.
40%. So what happens in D.C. with Medicare funding directly impacts almost half their revenue.
Directly and significantly. It makes them very sensitive to policy changes, funding levels, all that political stuff.
And the last piece under UnitedHealthcare.
That's community and state. This focuses on economically disadvantaged and medically underserved folks, often through state Medicaid programs. They served over 7.4 million people across 33 states and D.C. That includes over 1 million people through the ACA Medicaid expansion programs.
Got it. So that covers the sort of direct benefit side.
Yeah.
Now let's switch gears to Optum. You said this is the information technology and services side. Maybe less visible to the average person, but sounds just as powerful.
I'd say so, yeah. It's kind of the engine working behind the scenes, really deeply integrated into how healthcare gets delivered. It's pretty compelling when you dig in.
Okay, so let's dig in. What's the first part?
Let's start with Optum Health. This business is all about delivering patient-centered care, and they think broadly physical, mental, social, even financial well-being.
Okay.
It serves, and this number is just staggering, 100 million consumers.
100 million.
Yeah. And it partners with over 100 different health payer organizations, too. A really key part of their strategy here is what's called value-based care.
Ah, yes. Value-based care. We hear that term a lot. Can you break that down quickly?
Sure. So traditionally, healthcare has been fee-for-service. Doctor does a test, they get paid for the test. Does a procedure, gets paid for the procedure.
Right. Incentivizes volume.
Exactly. Value-based care flips that. Providers get paid based on patient outcomes and overall health. The idea is to incentivize keeping people healthy, managing chronic conditions well, being efficient, rather than just doing more stuff.
And Optum Health is big on this.
Very big. They actually take on the financial risk. They take responsibility for healthcare costs for patients under these arrangements, usually for a set monthly premium per person.
So they're betting they can manage care well enough to make that work financially.
That's the model. And they're not just clinical, they're financial too. Optum Financial, which includes Optum Bank, manages something like $24 billion in assets across more than 27 million consumer accounts. Think health savings accounts, things like that.
Okay, so they're deep into the clinical and the financial plumbing. That's a huge reach. What's next under Optum?
Next is Optum Insight. Think of this as the connective tissue. They provide services, analytics, tech platforms, all designed to make the kind of back office stuff simpler. Clinical processes, administrative tasks, financial workflows.
For who?
Yeah.
Who uses this?
Hospitals, doctor groups, health plans, even life sciences companies. They're trying to connect the dots across the system. And what really jumps out here is their order backlog.
Backlog, meaning future business.
Exactly. As of the end of 2024, their aggregate order backlog was around $32.8 billion.
Billion with a B.
With a B. And they expect nearly $20 billion of that to turn into revenue within the next 12 months. So it signals really strong demand for their services and tech. They're deeply embedded.
That is a powerful indicator, yeah. It shows how much the system relies on their infrastructure.
Yeah.
Okay, and the last piece of Optum.
That's OptumRx. The RX gives it away. This is their pharmacy care services business.
Like a PBM, a pharmacy benefit manager.
Exactly. It's a diversified pharmacy care business. They manage prescription drug spending across the board, including those really expensive specialty drugs, which is a huge and growing cost area.
Right.
They also specifically mention serving people with behavioral health and substance use disorders through OptumRx. In 2024 alone, they managed $178 billion in pharma spending.
Wow, $178 billion.
Yeah, and about $74 billion of that was specialty drug spending, and they fulfilled over 1.6 billion adjusted prescriptions. Just massive volume.
It's just the scale is hard to wrap your head around sometimes.
Yeah.
UHG is clearly this absolute behemoth, but, even giants stumble. What did their 2024 financials look like? Was it smooth sailing?
Not entirely smooth, no. While their total revenues grew, which is good, up 8% to just over $400 billion.
Still growing top line.
Still growing top line, yeah. But their net earnings, their profit, actually saw a pretty significant decrease, down 34% to about $15.2 billion.
Ouch. 34% drop in profit.
Yeah, and diluted earnings per share fell similarly, about 35%. And another key metric, the medical care ratio, or MCR.
Right, that's the percentage of premiums they pay out for actual medical costs.
Exactly. That ratio went up. It increased to 85.5% in 2024 compared to 83.2% the year before.
So a bigger slice of the premium pie went to paying doctors and hospitals. Less left over.
Precisely. Higher medical costs relative to the premiums they brought in.
Okay, so revenue up, profit down significantly, higher medical costs. What was the main thing driving that pressure?
Well, the elephant in the room for 2024 was definitely the Change Healthcare cyber attack.
Ah, yes, I remember that. It was huge news, seemed to affect everyone.
It was massive. So Change Healthcare was a company UHG had recently acquired, and on February 21st, 2024, cybercriminals got into some of their IT systems.
And Change Healthcare processes a ton of claims and payments, right? So taking them offline would cause chaos.
Absolute chaos. UHG had to immediately isolate those systems, and because providers, doctors, hospitals couldn't get paid through the normal channels, UHG had to step in. They provided over $9 billion in interest-free loans by the end of the year just to keep cash flowing to providers.
$9 billion in emergency loans. That's incredible. What was the direct cost to UHG itself?
The financial hit was substantial. They reported $2.2 billion in direct response costs just in 2024 related to the attack.
Okay, direct cost.
On top of that, Optum Insight, the segment Change Healthcare, lost an estimated $867 million in revenue due to the business disruption.
Wow.
And there's more. They also estimated about $640 million in extra medical costs.
How did a cyber attack increase medical costs?
Because during the disruption, UHG had to temporarily suspend some of its normal care management activities, things like prior authorizations to help providers just keep functioning. So more procedures might have gone through without that review, leading to higher costs later. It's like a triple whammy: direct costs, lost revenue, and higher medical spend.
A really complex and expensive mess. What about the people whose data might have been exposed? That was a big concern, too.
Huge concern. They estimated the total number of individuals potentially impacted was around 190 million.
Good grief. Nearly two-thirds of the U.S. population.
It's a shocking number. They said the vast majority had received notice by the time the report came out. Crucially, though, UHG stated they had no known evidence of individuals' information actually being misused. And, importantly, no electronic medical record databases appeared to be compromised in their analysis.
That's something, I guess. But still, 190 million people potentially affected. It just highlights the fragility, doesn't it, when one big piece gets hit?
Absolutely. And they noted they expect to keep incurring costs and dealing with disruption into 2025 as they work to get transaction volumes back to where they were before the attack.
Okay, so the cyber attack was a massive factor. Were there other things pushing up medical costs, too?
Yeah, they mentioned a few other trends. Beyond the cyber attack fallout, they just saw increased care patterns, generally people using more healthcare services. They also noted what they called an upshift in hospital coding intensity.
Meaning hospitals are billing for more complex, higher-cost services.
That's the implication, yeah. And they also saw an acceleration in prescribing of certain really high-cost medications. They suggested that was partly influenced by the Inflation Reduction Act, which has provisions impacting drug pricing and usage.
Right, lots of moving parts affecting costs.
Yeah.
What about something we touched on earlier, the Medicaid redeterminations? How did that impact things?
Yeah, that had an effect, too. That whole process where states had to recheck everyone's eligibility for Medicaid after the pandemic rules ended.
Millions lost coverage.
Millions did. So UHG saw a decrease in the number of people they served through their Medicaid plans. Now, they said that was partially offset because they grew their commercial enrollments, people getting insurance through employers.
Okay.
But it also created this weird timing mismatch, as they called it. Basically, the people remaining on Medicaid might have been sicker on average, pushing up costs, but the permit rates from the states hadn't caught up yet to reflect that higher acuity.
Ah, okay. So costs go up before the revenue adjusts. Sounds like a lot of headwinds pushing costs higher. What's their big strategy to try and manage all this pressure long term?
Well, a really key focus, and they emphasize this, is pushing hard to accelerate that shift we talked about away from fee-for-service and towards fully accountable, value-based care.
Trying to get paid for outcomes, not volume.
Exactly. The goal is ultimately higher quality care and lower overall costs. But they acknowledge this shift isn't easy or free. It requires pretty big upfront investments in new systems and technology for coordinating care and, importantly, in training doctors and getting them on board with this different model.
It definitely seems like a necessary shift, but a challenging one. Operating at this mind-boggling scale across so many different service lines, they must be dealing with an absolute maze of regulations, right? And tons of competition.
Oh, absolutely. It's incredibly complex. Their businesses fall under just this vast web of U.S., federal, and state laws, international laws, too.
Like, what kind of regulations are we talking about?
Well, you've got the really complex rules around privacy and security. Think HIPAA, HI-Tech. And those don't just apply to UHG directly, but also to their third-party business associates, which includes parts of Optum that handle data for other companies.
Okay, privacy is huge. What else?
Anti-fraud and abuse laws, which are always a major focus in healthcare. Specific regulations targeting PBMs, the pharmacy benefit managers like OptumRx, controlling how they manage drug lists, pricing, rebates, and even in some states, laws around the corporate practice of medicine, which can restrict how corporations can employ doctors directly. It's a minefield.
So it's not just following the rules, but the rules are constantly changing, and everyone's watching them very closely. How does that affect their day-to-day?
Well, the report uses the phrase frequent and often unpredictable change to describe the regulatory environment. That creates constant uncertainty.
Yeah, I bet.
For instance, Medicare Advantage payment rates are always under pressure. And that CMS star rating system for quality, that directly impacts bonus payments they can get and how marketable their plans are.
So lower star ratings mean less money and fewer customers.
Potentially, yes. Significant financial consequences if they fail to maintain or improve those ratings. And because they're so big and involved in government programs, they're routinely subject to government investigations, audits, which can lead to bad press, big fines, or even, in extreme cases, being kicked out of programs like Medicare or Medicaid.
Wow, the stakes are high. And they're not just dealing with regulators, but fighting off competitors too, right?
Fiercely. The 10K uses the term significant competition across all their markets. They're up against everyone from nimble little tech startups focused on one niche to other massive global players and even large nonprofit health systems.
So they have to constantly be innovating just to stay level, let alone grow.
Constantly. That intense competition forces them to keep innovating new products, better services, smarter technology, competitive pricing. The report specifically calls out that failing to innovate, especially in hot areas like value-based care models or virtual and in-home care, could put them at a serious competitive disadvantage.
So staying ahead of the curve isn't just nice, it's essential for survival. Okay, let's shift to how UHG actually sustains this massive enterprise. Let's talk about their capital, their people, and how they look to the future.
Right. Well, they really emphasize their human capital, those nearly 400,000 employees, including the 140,000 plus clinicians we mentioned. They talk a lot about investing in developing a skilled, diverse workforce. Things like skills-based learning programs, initiatives focused on company culture, leadership training frameworks.
Standard corporate stuff, or is there more to it?
Well, here's something interesting. They actually have something called an Employee Experience Index. And performance on that index is a metric used in their annual incentive plan for executives.
Ah, so they're tying executive bonuses partly to how employees feel about working there.
Seems like it. It definitely underscores that they see an engaged, inclusive culture as strategically important, not just fluff.
That is interesting. Okay, what about the hard cash? The financial foundation. How does a company this complex manage its money?
Well, remember, UHG itself is a holding company, so its main sources of cash are dividends and reimbursements coming up from its various operating subsidiaries, many of which are regulated like insurance companies.
And those regulated companies have rules about how much cash they have to keep, right? They can't just send it all to the parent.
Exactly. They're subject to minimum capital requirements and restrictions on paying dividends. But UHG does rely on those dividends. The subsidiaries paid over $9 billion up to the parent companies in 2024. They also use things like a commercial paper program and bank credit lines for financial flexibility.
And what's their overall cash position look like? Do they have a cushion?
A very large cushion. As of the end of 2024, they held over $25 billion in cash and cash equivalents. Plus, they had nearly $47 billion in debt securities and almost $5 billion in equity securities they held as investments. So you're talking about, what, over $77 billion in total financial assets, plenty of stability and dry powder there.
Definitely a strong war chest.
Yeah.
And that probably helps them maintain good credit ratings.
Yes, very strong ratings. They listed A2 from Moody's, A+ from S&P, A from Fitch, all with a stable outlook. Those ratings are critical for them to access capital markets cheaply and just maintain their competitive stance.
Makes sense. And what are they doing with all that financial strength? Are they returning it to shareholders? Investing in growth?
Both. On the shareholder return side, they increased their quarterly dividend in June 2024, putting the annual rate at $8.40 per share. They also actively buy back their own stock. They had authorization to repurchase up to 33 million more shares at the end of 2024.
Why do they do the buybacks?
They say it's to optimize their capital structure and also to offset the dilution that happens when they issue stock for employee compensation plans.
Got it. And acquisitions, are they still buying other companies?
Oh, yeah. They specifically mentioned they anticipate needing about $4 billion in capital for acquisitions that were already pending in the healthcare sector. So growth through acquisition is still very much part of the strategy.
Okay, one last piece from the 10K that seems really important, especially given the MCR discussion, is this idea of critical accounting estimates, particularly around medical costs. Can you unpack that a bit? It sounds complex.
It is complex, and it's crucial to understanding their
Uh,
financials. Because they process such a massive volume of healthcare claims, a lot of which take time to come in and get paid, they have to estimate how much they'll eventually owe for care that's already been delivered but hasn't been fully billed or paid yet. That's the medical costs payable.
So it's an educated guess about future bills.
A very educated, but still inherently uncertain guess. The 10K calls it out as involving challenging, subjective, or complex judgments. There are just inherent uncertainties. How many people went to the doctor in December whose claims haven't arrived yet? How much will those claims cost? Are costs trending up or down?
And tiny changes in those guesses could have a big impact.
A huge impact. They give a sensitivity analysis example. They say, hypothetically, if their final estimate for medical costs payable at the end of 2024 was off by just 1%, one single percent,
Yeah.
that 1% difference could change their reported net earnings for the entire year of 2024 by roughly $260 million.
Wow. $260 million swing based on a 1% estimating difference. That really drives home how complex managing those medical costs is and how much judgment is involved in their financial reporting. It's definitely not simple arithmetic.
Not at all. It's a high-stakes game of actuarial science, trend analysis, and, yeah, educated estimation.
Okay, so we have truly peeled back some layers here on UnitedHealth Group. We've seen the incredible scale, those two powerful engines, UnitedHealthcare and Optum, and just the sheer diversity of what they do.
Yeah, and we've also seen how even a giant like this can be significantly impacted by major events like that Change Healthcare cyber attack.
Right, alongside those ongoing pressures from rising medical costs, the constantly shifting regulations, and that intense competition we talked about.
And I think what really stands out for you listening is how UHG's strategies, how they try to manage costs, how they push towards integrated care and value-based models, how they use technology, how they respond to challenges like cyber threats. All of that directly shapes the healthcare system that we all navigate. It influences the services available, the costs we face, the options we have. Their moves aren't just corporate decisions happening in a vacuum. They really ripple outwards and affect the future of health access, affordability, and even just the experience of getting care for potentially millions, maybe even you or people you know.
That's a great point. It really brings it home. So, thinking about all that, here's a final thought to leave you with. Given UnitedHealth Group's massive integrated model and its undeniable influence on almost every piece of the health system, what does its continued evolution, especially its stated goal to make the health system work better for everyone, what does that truly mean for the future? How does that balance play out between innovation, cost control, and the actual personal experience of being a patient in the years ahead? And maybe, what questions does UHG's scale and strategy raise for you about where healthcare is heading?
Yeah.
Something to think about.